Hello, and thank you for joining us today for this special event, Crazy is Not a Diagnosis, Understanding Mental Illness and the Black Community. And my name is Tressica Hamilton. I am the founder of the Sid Center, a health agency specializing in Black boys diagnosed with behavior disorders and juvenile justice involved youth. And the goal of this event is to transform lives in the Black community by helping you to understand mental illness and also to help you improve your mental health. So that's the goal for this event today. And also we'll discuss today how to triumph over trauma. We'll understand more about suicide and substance abuse, as well as the mental health battles of Black children and healing families to heal generations. And I want to introduce our powerful guest speaker panel today. And joining us today is Renette Arnold. She is the CEO of the Empowerment Agency. Renette is licensed in the state of Georgia and Florida as a licensed clinical social worker. She holds a national certification as a master addiction counselor and is an approved family violence intervention program facilitator. And Renette provides consulting services to corporate clients, faith-based communities, and individuals nationally. She is a sought-after national and international speaker on various topics related to behavioral health, suicide prevention, leadership, and women's empowerment. And we also have Socrative Michael. She's a licensed professional counselor and a licensed marriage and family therapist in Atlanta, Georgia, and the co-founder of Michael and Michael Counseling and Consulting. She provides individual, couples, and family therapy. Mrs. Michael is well-versed in a variety of therapeutic modalities and holds specialty training in anger management, sex therapy, and spiritual counseling. Additionally, she holds a certificate as an employee assistance specialist. She is passionate about helping people to heal from life experiences that have left them hurt and feeling hopeless. She has a special heart for women, couples, and families that suffer from abandonment and families living with unhealthy generational patterns. And I want to thank you all for taking the time to be here today and for sharing your expertise to help heal the Black community. And so I just wanted to get started with some of our questions that we'll discuss today. And the first question is, what is trauma? Because a lot of Black people are dealing with trauma. They've experienced it, but they don't understand that that's what they're dealing with and how it contributes to their mental health.
Any particular order, or are we just jumping in?
Oh, you could just jump in.
So first, I want to say thank you for this amazing platform and having us here today. This is so important to have this discussion and dialogue, and especially the opportunity to ask questions in an intimate setting. In terms of trauma, I will say one of my definitions and the best description I can give, it's not a particular incident, but in fact, it includes our reaction to an incident that occurs. So what may be traumatic to myself may not be traumatic to you or someone else, but it's about our the incidents that occur that impact our ability to cope with it, that supersedes our current coping skills, and then our reaction to that. One of the best indicators that that I've used in terms of helping individuals identify bless you, is the ACE, the Adverse Childhood Experiences Assessment. It's a quick assessment form, and it identifies incidents that may have happened to you before the age of 18 years old. And I remember the first time I took that assessment, there were some things on there that I knew was traumatic to me, but no one else I heard talking about said, well, this is traumatic. And one thing in particular, I'll be transparent, was about individuals being incarcerated. So I had a brother who went to jail. And so that was a very traumatic experience for me. I was traumatized as his baby sister, but nobody talked to me about trauma. So that's one of my best experiences and tools that I use in terms of explaining trauma.
That's excellent, Renette. I would say, would add to that as well. Trauma impacts the way you do your day-to-day life. If you are finding yourself having difficulties at work, at school, concentrating, having problems with feelings of sadness or loneliness or shame. All of those things I would say would indicate also some level of trauma that has occurred within your life. I think what's happened is that, and trust I may be going forward, you can definitely stop me if I am, but I think what I'm seeing mostly within the Black community, we've never talked about the actual word of trauma. It's never been okay to say that word. And I think probably in recent years, as we've opened up the discussions to talk about mental illness within the Black community, we've been able to identify what it is we've actually been experiencing for so many years. So yeah, we've just kind of normalized it though. And I'm happy that we're having these type of healthy discussions to say it's okay to actually name what you're experiencing. And it is trauma. And trauma, as Ms. Renette had spoken about, it can be one thing to her and another thing to me. Okay. But to honor whatever it looks like for you and to say, you know what, I'm really not okay. I'm experiencing some feelings and I'm really not okay. And I don't know what those things are called. So I think that's probably that in a nutshell, if you will.
Okay. Thank you, ladies.
Mm-hmm.
And I think that's an important point is that we've normalized it for so long.
Mm-hmm.
So we bear so many burdens and we don't realize that what we're dealing with and how to vocalize it.
Absolutely. And even within, I'm a Christian counselor in addition to, LPC, LMFT, but I'm also was trained in Christian counseling. And when you talk about Christians within the Black community, when you talk about mental illness, the first thing they say is go to church. Go lay it down at the altar. You ain't prayed hard enough about it. I don't know why you just can't get back on up and God gonna heal you. And let me just say for all of our viewers and all of our listeners, God is almighty. He hears you, he understands you, but he also gives us resources. Right. And we're the professionals of those resources to help you when you're feeling that way as well. I'm not saying don't go pray. I'm a prayer. Go pray. But in addition to that, after you get done praying, you may have to take some medication. Okay. Right. You may have to go to see a psychotherapist weekly to help you through that process as well. So no, it's not that the devil is on you. The reason why you're depressed and you ain't prayed enough. It's not that at all. It's your human. Right. That's really what it boils down to. And we as humans, we're going to experience some level of trauma. So just want to throw that in there too, Ms. Jessica.
Okay, thank you.
You're welcome.
Okay, and the next question is, let's talk about the impact of suicide on the Black community. It's like a big taboo that we deal with in the Black community, suicide. So let's have a discussion about that.
Mm-hmm. Yeah, it's so important. I'll say when I first started specializing in suicide, I was one of the very few African Americans sitting at the tables that I was sitting at talking about suicide. And being in the metro Atlanta area, we were going out to communities of color and no one on the panel looked like us. Mm-hmm. And so I remember being at one of the college campuses and we were in a room full of Black and brown men and women. And so I looked around and I said, they're not getting it. It's not really hitting home. They're looking at the panel. They see me, but they're looking at the panel and they're looking at this beautiful quilt it's a memorial quilt. And it had all of these faces of people who had lost their lives to suicide, but none of them looked like us. And so I went ahead and put the elephant in the room to say, I know that many people don't look like us when we start to talk about suicide, or there's this myth that Black people don't kill themselves, but it's not true. In fact, suicide is the 16th leading cause of death currently for Blacks of all ages, and then the third leading cause of death for Black males between ages 15 to 24. So we got to talk about it. We can no longer continue to walk around in our communities as if this doesn't impact us. Absolutely. Keep in mind, and I'll always point this out, these are the numbers that are confirmed by the CDC to say, yes, in fact, these were suicides. What about those that it's unknown? What about those who were in car accidents? What about those who engaged in risky behavior that caused them to be harmed or killed or suicide by cop and things like that are happening in the community? So I'm just thankful that now we're starting to shift a bit more. I want to see more. in terms of just having dialogues and not just talking about suicide when a celebrity dies by suicide.
Right, right. I totally agree with you too, Renette. I have clients that I see who have family members that have committed suicide. And I think that what I've seen also is that people are so afraid to talk about this because they're like, if I mention it, oh my God, that's going to give them the idea to go and do it. And that's just not true. You don't have that much power. But it's something that's very serious for us to really put the spotlight on and to really understand that it's impacting us even at such early ages. When I worked in the college campus area, I remember getting a phone call that said, I need you to counsel a young lady who just witnessed a person jumping off one of the buildings of the campus. Yeah. And I myself was traumatized because I said, my God, I couldn't even imagine. And sitting with this young lady who had witnessed what had just occurred and working through that trauma with her, it happens every day. This is not anything new. You know, we're talking about it like it's new, but it's not new. Unfortunately, it's been in our lives for a very long time. And understanding the impact that it actually has on yourself and on your family members as well, you know, survivor's remorse, you know, like, oh my God, I'm here, they're not here, what did I do? Just having those healthy dialogue conversations about it. So, yeah.
It's so important to have that conversation. And you mentioned the early ages. I have a lot of clients, a lot of boys that are under the age of 9 who are suicidal. And so a lot of children, Black children are in a lot of pain. Yep. So it's so important that the adults have this discussion so we can show the kids that it's okay.
That's
and show
right.
them, you know, what it looks like and what the alternatives are. And I love the visual, Renette, that you mentioned about that quilt. I think that's important in the Black community to have those type of quilts. Yeah. So that kids and adults can see the visual that these are the people who have committed suicide and that, yes, it is happening in the Black community.
Absolutely.
It's important that we had that discussion.
Socrates, you made a good point that I really like to address, especially when I have this dialogue about people saying, well, I don't want to ask because if I ask, I don't want to plant that seed. Right. And so one of the things that I always say is, remember when we went and talked to youth about sex education. Don't talk to them about sex in schools because if you start talking to them about sex, they will start having sex. But they were already having sex.
Right.
So
exactly.
Same thing with suicide. We have to normalize, not that suicide is okay, but we have to normalize the conversation to say that individuals are suffering and they're suffering in silence. They're hurting. They're experiencing trauma because of something that has happened to them, not who they are. So we have to let them know that there are places to get help for us.
Absolutely. That's very true.
You who looks like you, who will talk to you about suicide, who will seek to understand what you are going through and experiencing so that we can get you the help that you need.
Right. Yes. And understanding the history of, you know, when I sit with couples, I see a lot of couples as a marriage and family therapist, and they may be having struggles within their marriage that hasn't been addressed because their family members may have committed suicide. So there's so many different parts to this. It's just not a linear at all. It's so many different parts that are added into this, where when you have experienced someone's suicide, they've abandoned you. Right? So in that abandonment area, we're not thinking how that's impacting the relationship that you're currently in as well. So even understanding what that looks like after the person has committed suicide.
Yeah, absolutely. And that additional shame and stigma.
That's
so
right.
Not only am I in a situation where I don't feel comfortable talking about this issue of abandonment. First of all, what is abandonment? I can't even verbalize that I feel abandoned. And then shame and stigma of mental health conditions or suicide. I can't mention that in my community. Who's going to talk to me about this?
Right. Very true. Very true. And the person, one of the clients that I've seen, their partner just was put off as well. Like, how is this impacting how we are now? Huge impact. And being able to just really have that psychoeducation, just explaining to them, having the healthy dialogue about it.
Yeah.
Right. And linking it back to our first question, that's trauma. That's a traumatic situation.
That's it right there.
That we forget to acknowledge that
Yep.
this happened to this person.
Absolutely. Totally agree.
Thank you for the excellent feedback. And let's talk about substance abuse in the Black community, because some Black people use substance abuse to self-medicate when they have a mental illness. So let's have a discussion about substance abuse in the Black community.
Renette, you want to start? You want me to start?
You start and I'll piggy off you.
Okay. Well, we know it's an epidemic, been an epidemic for years. I sit with clients all the time with substance abuse. I feel like that we have suffered from substance abuse disorder for years, for many years, but I feel like very recently it's been more federal funding help because of the opiate crisis that's occurring. And it to me, it's very biased, but I'm not going to get into all that today. But those are just my personal feelings as relates to that. But we've been suffering from substance abuse substance abuse disorder for many years. This is not anything new at all. I think we've all had some type of family members who've suffered from it as well. And we really didn't talk about a lot of treatment within our community. Very recently, we've probably introduced more treatment because of the more programs that have become available and our ability to have health insurance and things of that sort. But we've never really talked about treatment. We've kind of just been saying, this is what they do. We've kind of let it play out within the families and how it impacts the different families. But we really haven't kind of stepped in to say, you know what, this is really an epidemic, just as trauma is an epidemic within our community. And what can we do really to help the community?
Absolutely. I agree wholeheartedly. I'll say one of the biggest challenges for myself as a clinician and also as developing program and just witnessing it in our communities. Mm-hmm. We completely, and I agree wholeheartedly with you, Socrates, we completely normalize that, using substances is normal. You know how they are, or they just or they just do this and they just do that. And so we have to educate and retrain and let them know that this isn't normal. What are you covering up? What are you numbing out that you aren't dealing with because you're using so many substances? So again, often it's going back and uncovering the layers and saying, okay, what happened to you?
That's it. It's the trauma of it all.
Yeah. When did you first start using and know it's not normal? And that takes a level of vulnerability and transparency, and also challenge the person to say, hey, this is what you're doing. You are self-medicating, and having real conversations to say exactly what you are using.
That's true.
I agree wholeheartedly in terms of there's a lot of funding right now for treatment. And however we got the funding, I'll say it like that, however we get the funding, this is a prime opportunity for us to tap into it and utilize it. Never before have people looked at substance use disorder as we are looking at it now. And so I hope that our community really starts to take advantage of that and reach out and get the help and the services that are there. One of the most challenging things is there being a lot of talk about the opioid epidemic and individuals losing their lives, and there not being enough Black and brown people at the table to say, hey, my loved one lost their life or struggling with the opioid addiction as well. And it does happen. It has happened in our community for so long. But again, now that the face of it has changed, a lot of the media attention is geared towards that, but it impacts us as well. I do want to offer a resource. There's actually I don't know if I want to call it a law, but I believe it is a law. Don't Run, Call 911. And it occurred because there were some parents who went down actually to the state capitol to advocate because their children died of an opioid overdose. And so they were able to get legislators to approve that. There are some particulars to it that I will say you want to look into it. But if someone is overdosing, you can call 911 and they will not arrest you. And the whole goal of that is to help save lives. Those first responders typically have naloxone, or you may have heard to it as the brand name Narcan, in order to help individuals who are overdosing in that point in time. And it has saved many lives. So us too, again, in our communities, we have to be aware of what laws are there, however they came about, that we can tap into as well, because those naloxone and Narcan is actually, you can get it free of charge. But we need it in our community as well, because again, this is impacting us, and we have to tap into those resources and outlets.
That's true. And to know, I'll speak from even a couple's perspective too. You know, I see couples who are partners suffering from some type of substance abuse. And I say very early on that you can't save the person. Most oftentimes we enter into relationships and we're hoping that we will be the person that this person chooses to quit for. You know, I love them so much, I'm gonna stop using that abusing. And the reality of it is, it oftentimes never happens that way. So when I sit with couples who I know that one partner is in recovery, I speak very loudly and letting them know that recovery has to come first. It has to be your higher power, then recovery, then your marriage or your relationship. And if it's in any other order besides that, it probably will not work at all. I've seen people that have stayed within marriages for so long, hoping that the person would change. And what happens is their life becomes destroyed, waiting for that change to actually occur. So I'm saying, when you deal with substance abuse disorder within your relationship or marriage and they're not in recovery, you have to save yourself because if you don't, you'll get the sinking as well. Now, I have seen couples too that the person has gone into recovery and they've come back out of recovery and they're clean and they're working the recovery still, so very active, and they've gotten back on the good path in their relationship, which is amazing. So I just want to be able to say that, because we deal with substance abuse disorders in our communities as well, in our marriages. And I see the cycle so many times of trying to save them, and you're sinking as well. So just wanted to put that out there.
Thank you.
Yeah.
And let's talk about the mental health issues affecting Black children. I mentioned earlier about even the young children, having committed suicide or attempting suicide. And also Renee earlier mentioned the ACEs. So let's talk about that, because our Black children are suffering as well in our community. And, just to help people to stop, in the Black community, to stop suffering in silence, to know that they're not alone. Because that's one of the issues. People think they're alone, but we're all dealing with, our own struggles, and so nobody's really alone. So let's just talk about the Black children.
So I'll say this, we could take this so many ways, but I'm going to start from a perspective of just having the discussion and dialogue at home. My hope is that moving forward, as our community shifts, that we start to have these conversations at home, not necessarily just about mental illness, but about mental wellness. What is mental wellness? What is a healthy mind frame, a healthy mind state? How do you take care of yourself? Because if you're not well mentally, you won't do well in school. You won't do well in terms of your social relationships as you begin to grow up and foster relationships. Your spirituality isn't right. Your finances isn't right. So it impacts so many different areas of your life if that one core piece isn't right. So my hope is that families will start to have conversations about mental wellness and then teach youth life skills. How do I take care of my mental wellness? How do I know or recognize when something isn't right? And then how do I reach out for help? And what are the life protecting factors to keep my mental health well? How do I take care of myself? When do I need to take a break? How do I recognize when I'm overwhelmed or when something is worrying me that I need to just sit still or speak with someone, to a support system, or go exercise or just meditate and things like that? We need to start building our youth up so that they are doing that now. So when they start to grow in terms of being adults, that they carry those skills with them.
I totally agree with you, Miss Renette. I think that you said the biggest thing is kind of educate at an early age. I think, I can't recall what article I seen this in, what newspaper I seen this in, but I did remember recalling students that were sent to, what do you call it? After they got in trouble, what do you call it?
Oh,
Kids.
detention. Detention.
Detention, right. They were in detention, but they were teaching the kids yoga while they were in detention.
Yes.
And I thought that was so powerful.
Yeah.
And I just love the fact that, you know, if we can just teach the children, as Ms. Renette said, mental wellness, how to practice self-care. What does self-care even look like?
Right.
And then helping them to identify their emotions and their feelings. Even if we have to use feeling charts, I know I use them in my practice. What feeling are you actually having at the moment? You want to be able to communicate that and really have parents to listen and not be so upset or so quick to want to yell or want to scream because they're not getting the results they were hoping to get from the child, but just helping them, teach them mindfulness as well. Kids do what they see you do. Not what you so much tell them to do, but what they see you do. So if you are in tune with yourself and you're having some very good, healthy self-care techniques, your children will actually follow suit with you. If you're sitting every morning for 10 or 15 minutes and you're doing quiet time and doing some yoga or doing some meditation or reading your word or whatever that looks like, your children will want to emulate what you're doing as well. So I think it first starts with us, Tressica, to help us understand what that looks like for us first, so we can be in a better position to teach our children what it looks like for them as well.
Yes. Thank you for those great tips and examples.
You're welcome.
And let's also discuss severe mental illness and the need for medication for some conditions. And how can we encourage Black people to seek mental health treatment for severe mental illness?
So I have this conversation actually quite often because I tend to come across individuals who are so pro, I won't do any medication. And again, thinking that we have a lot of historical issues in terms of not trusting medical professionals. And I do believe, I just encourage anyone, get an assessment, go to a mental health professional, go to someone who you trust, get a referral, fill them out. Just as if you are getting to know someone or you are going for a job, research, get online. Read the website, see what they offer, talk to that person, find out what their thought process is, what their framework is coming from, how do they feel about it. Any questions that you have, ask that person so you can get a good gauge on what's the professional who you are dealing with. And then if medication is prescribed, keep record of it. When you start to take medication, keep record of how you feel when you're taking it, what you are taking, and when you take it. A lot of the times what I see is when individuals start to take medication, they often don't take it long enough to even see the therapeutic effects of it. And so, no, it's not going to help you because you're not allowing it to balance out in your system long enough for it to meet that threshold to have an effect. And so then they may go to another professional who may prescribe a different medication. And so you're just in this cycle of not really getting the help that you need. So one of my suggestions is if you are indeed going to try medication, which I've seen situations where medication has done amazing things, and I've seen situations where medication may have had to be adjusted. But again, that individual took the medication for the amount of time it needed to be taken, and they followed up with their psychiatrist to say, hey, this is what I'm experiencing. Can we adjust it, or what can be done to help deal with some of the side effects or things that I'm dealing with? The other thing that I want to say is I always ask my clients to also go get a medical assessment, a workup. How are your vitamin levels? What's going on with you medically and physically that may be impacting your mental wellness as well? Because sometimes we can have something going on with us organically, or we can have vitamin deficiencies that starts to mimic mental health conditions that we don't know are going on. And then we go to the doctor and get prescribed medication for psychosis or other mental health conditions.
I agree with you, too, Renette. That's probably one of the first things I encourage my clients to do is the first question is, when was the last time you had a physical?
Yeah.
What were your results like? You know, what was your vitamin D looking like as well? You know, just those.
For us.
Yeah, it is. It's very huge.
Huge.
Yes, very huge. We have so many of us are walking around with vitamin D deficiency, and they have no idea. Just sitting out in the sun, let some of that sun hit you. You'll be so surprised how your mood can switch. But I do agree with you too, Renette. I think that it's important to get an assessment to clearly define if medication is needed. And if it has been defined that it is needed, I'm a big proponent of medication with therapy. I'm not a big proponent of medication without therapy.
Right.
I think they two go together, and I don't ever want it to feel like, now sometimes you have to take medication forever and ever and ever, but I like to believe that you just need medication for a certain period of time for us to work together through your trauma in order for you to be able to get off of that medication. I would hope that it's not something they have to have forever and ever, but sometimes it's like that, unfortunately. And you did speak on too about how you have to try so many different medications, kind of get the quote unquote right cocktail, if you will. And that becomes very frustrating, understanding how to find that right cocktail, right? There has been a DNA test that will help clients understand how psychotropic medications metabolize within their system. This was a test that had been approved by Medicaid and Medicare, if I'm not mistaken, that would pay for these type of tests to be done for our clients. And it's just a really quick swab. And what will happen is they'll get a long test and assessment that shows exactly what medications will metabolize better within their system. So they're able to target which ones they perhaps should try first, and the ones perhaps that just will not work really well within their system. So there are different things that they can actually try, but I don't know the name of the test. I'm so sorry about that. But if you Google it, I'm pretty sure you can find it as well.
And thank you for bringing that up, because that's huge. Because again, when we talk about our community, we are so different as a people and our bodies and how we metabolize stuff. And when we think about the clinical trials of other medications, they typically were tested on other races or ethnicities. And so this is huge for us. So I say to anyone thinking about seeking treatment, go now. Now is one of the most amazing times, because there is so much stuff out there. We are a lot more educated, and the field is really starting to take into consideration culture and how it impacts us individually.
Absolutely.
Thank you, ladies. And I also want to discuss our final topic is how can we help families to heal so they can heal future generations? Because it's all about starting with the family, but that also helps to heal future generations.
It's true.
Absolutely. I'll say this is an amazing question, and it is a journey that you have to start somewhere. And I do believe it starts with having open, honest conversations and dialogue, talking about trauma, talking about past experiences, and creating an environment that's appropriate for those involved. You can do it in layers. You can have an adult session or a core group of people, depending on how your family dynamics is, and then plan it out to address each other family member or subgroup of your family when we start to talk about total healing for the family. We can't do it in isolation, because then some are going to get healed and some are not, and it's going to cause more conflict. But about having these conversations and dialogues and going to get help. And, I truly believe in getting outside. There's healing outside, outdoors, in the atmosphere. Also doing trust building activities with your family members and things like that. Because in order for us to heal, we were created to exist with our families and to have support. So we have to do it together. It has to be a collective and communal activity and process that we're going to go through.
I agree with you in that. I'm a big proponent of stopping the secrets. Our families have so many secrets. And what happens is that the secrets get buried, and then from generation to generation to generation, and there are never any really answers to what happened. So when I say family, I like to uncover what are those secrets? What are those things you've heard within a family that you were afraid to address? And I like them all to sit together in a circle, and I want us to discuss, and each person have the opportunity to discuss how they feel. Right. And to stop burying what happened in the family. Stop acting as if it did not occur and it did not impact how you feel. So I think everyone has a voice, but oftentimes within families, within most groups, someone's scapegoated. You know, someone is called the black sheep of the family because they haven't gone along with the rest of everyone else's thoughts and feelings about a topic. So I teach the families about what healthy families look like and how to create meetings once a week with your family, how to create rituals of connecting with your family, whether it's sitting down together as a big family for dinner. And I think oftentimes within the Black community, we all get together, on Sundays, right? Get that fried chicken, some collard greens, eating really good. But those are rituals that we've had for many years. But I think as we talk about mental illness, we need to take it a step further and say, how did you feel this week at school? Not what happened, but how did you feel about what occurred between you and the teacher, or what occurred between you and the person on the playground? To have those and help them start identifying the feelings. We need to become more emotionally intelligent and teach our children what emotionally intelligence looks like. For them and also for us too, and not to have them feel the way we want them to feel, but honor where they are. I think that's really huge. But I really encourage the family meetings once a week, family outings, and we plan them around as if it's just a meeting. You know, you have an agenda, you put things that you want to talk about in a box or whatever, and I have the family create a box and put those agenda items in that box. And on Sundays, one family member, and this could be the kid, the teenagers. I want everyone involved. Everyone has a piece within the family, and it helps them to stay connected. And they look forward to doing that because they feel like they have a voice. And I think that's the biggest thing for where we are right now. Children don't feel like they have a voice. They don't feel like their feelings are important, you know? So to be able to create that platform for them, I think is very powerful.
Yes, it is.
Absolutely. And chiming in off of what you just said, which is so key. So 2 things came to mind in terms of phrases that we say in our community that harm us in this healing process. One is kids are to be seen and not heard. Yeah. I've heard that so many times from adults. I've had a 75-year-old lady who disclosed some trauma that happened to her. And when asked, who did you tell? She said, who could I tell? Kids are to be seen and not heard. That's harmful. We cannot continue to repeat those things in our communities because when things happen to our youth, they don't feel like they have the right to voice what has occurred. And another one is, and we talked about this earlier, what goes on in this house stays in this house. That perpetuates individuals suffering in silence, and we shouldn't do that. Our families have to create a safe space, an environment for them to talk about mental wellness, mental health, any incidents of trauma, etc. that have occurred, and definitely what are your feelings. We see adults all the time who cannot identify feelings other than I'm happy, I'm sad, I'm mad, and that's it. It's true. And so it's how do you feel about this situation, and then expressing it. It's okay to cry, things like that are just normal things that we have been conditioned that we don't have the opportunity to do, and that shouldn't be the case. It's healing in that.
Absolutely. Totally agree.
Yes. Well, thank you so much, ladies, for a powerful discussion today.
Oh, you're welcome.
And I want to see if anyone has any questions for our guest speakers.
I have a question. Besides, I know some of you are therapists and educators, and information goes out to the people that you guys work with or people that you guys teach. But how do the rest of the community that's not part of the education or that's not part of getting therapy, how do they get the information about self-care or about that interracial trauma that's going on? So how do we? My question, like, how do we spread information to them? Like, I mentor a couple young adults, young men, and I kind of like spread information to them. But I know that there's like community centers and there's like coaches of all different types of sports that they don't have this information, and I kind of feel like they should be spreading information also.
I agree wholeheartedly with you. And so one of my things that I love, I've been involved in community work for a long time. Cross-sector collaborations is one of my passions. And we do need to do a better job of bridging the gap between mental health professionals and the community. One of the things that I really try to do is to share information via social media outlets. I understand that oftentimes I am the last person that someone will come into contact with. I get it. Usually it's either when they are forced to come into contact with me and it's their last resort, or someone has said, no, I need you to talk to Renette because she does X, Y, and Z. So social media is a way for me to share information. One of the things that I would suggest for you as a mentor is to make connections within the behavioral health field. Definitely, Jessica will share my information. If I can share anything, let me know. But also to identify key organizations in the community. There's NAMI, National Alliance of Mental Illness. There's Mental Health of America. Those organizations provide print material. They have a lot of free support groups, etc., where community members can tap into and attend groups, get support. They can actually become certified in training so they can go back and teach their community. And that's really what we need. We need people in our community who aren't always therapists to go in and get trained to do these groups and then go back into your community and talk to people about it. Because someone who knows you and has a trusting relationship with you would listen to what you have to say more than they may listen to me at that time.
Yeah, I agree with you too, Renette. And then too, for yourself, I would say, Mr. Jackson, to experience some type of therapy or group or community involved just for your own personal self, so you can go back and you can say, this was my experience and this is what it's looked like for me and this is what it's done for me in my life. And I think that is probably the most powerful piece, because if they can say, well, if you trusted them enough to try it for yourself, perhaps I can do the exact same thing. It gives them permission to do the exact same thing.
Okay. Thank you.
You're welcome.
Thank you for your question, Mr. Jackson.
Great question.
Yeah, awesome.
This is Dr. Pam Fox on the line, and I have a couple of questions. One, I'm a family therapist and clinical social worker, and my experience indicates to me that all families are dysfunctional. And that in that regard, that all families are dealing with issues of not trusting, not talking openly and honestly, not expressing their feelings, projecting blame, displacing anger, scapegoating others, maintaining family secrets. So I identify with a lot of things that were discussed this evening. But if we go with, and this is from research, evidence-based research, that all families are dysfunctional, then that's important for us to know. Important for us to know. And then for us as a people of Black people of African descent, and especially us here in this diaspora, that we have to be aware about historical trauma, and I would say post-traumatic slave syndrome, in terms of us being the progeny of our ancestors who were impacted by human trafficking. We talk about trauma-informed care. Our people, our African American folks, need trauma-informed care.
Absolutely. Absolutely. I agree wholeheartedly with everything that you just said. And oftentimes, unless you are in the field and do this work or have been exposed to it, many communities or families don't get this conversation. And so we have to, again, bridge that gap so that we can help them understand that it's not just you. It's not just you. We have experienced so much historically, the way society is set up, the way that systems work that impact us. Absolutely. I could go on and on about that. Yes.
I agree too. Totally agree with everything you said too. But I think it starts with kind of what we're doing right now too, is starting the conversations. Because I think the more you talk about it, the more it gives other families and other people to accept it, to engage with it as well. And it goes kind of back to what I was telling Mr. Jackson as well. The more we say, well, this is what we've experienced within our family, our whole family went. We talked about our traumas. We talked about the things that we were not, quote unquote, supposed to talk about. And this is how it has impacted our family. And being able to continue the conversation over and over and over again until it becomes more normalized within our community.
Yeah. And I'm a firm believer in when you know better, you do better. So I love the epiphanies and when the light bulb goes off in clients' head when they identify that it's not just me. It's not I'm like this because of just choices I've made, but because of all this other stuff that has happened to me, the trauma. Mm-hmm. This is the way things are currently right now set up for me. And now what can I do to address the incidents that are going on and to get that healing that I need?
Again, we are in this season of family reunions, times of celebration. In many parts of our nation, families are getting together to have really good times. And that's a wonderful thing when families come together. But again, what we're talking about in terms of starting those conversations is so vitally important. We have to leave the victim mindset. We are survivors and we want to get to a place of thriving and celebration. And we have to do that one person at a time, one family at a time, one community at a time.
Very true.
Thank you so much for your question, Dr. Fox.
And I just want to add this. Dr. Fox made a very good point in terms of right now being a time where family reunions are occurring. So one of the things that I really like to do in terms of building programs, it doesn't have to be so programmatic, right? Yeah. So we have to teach individuals that it's not textbook. It doesn't have to be very clinical. It shouldn't be medical model, but us having just genuine dialogue about incidents that have occurred or about mental wellness and mental health conditions so that we can start it so that individuals won't feel like I'm forced to hear this information, so that we can see the value in it and that we're doing programs differently, but also taking them actually the community, to where people are. Some of the programs that I've worked with, we've done skate-a-thons where, the kids were brought out to skate and we did some HIV prevention messaging during the little breaks between songs and things like that, or community events where individuals were able to watch a play and then they got messaging as well. Something that is fun that individuals like, that they can be involved in, but they still get some information and some education about important social issues that impact our families.
Does anyone else have any questions? So I thank you for your questions, Mr. Jackson and Dr. Fox. And so if no one else has any questions, I'll go ahead and wrap this up. Just make sure. Okay. Well, thank you so much to our wonderful guest speakers, Renette Arnold of the Empowerment Agency. And Renette, what's your website?
It is www.empowered-consultants.com.
Okay. And also Secretary Michael of the Michael and Michael Counseling and Consulting. And what's your website, Secretary?
It's www.counselingwiththemichaels.com.
Thank you. And also, like I said, I'll send out the free resource guide. It's called Black in Healing, a mental health resource guide for the Black community. And you'll be able to learn more about our wonderful guest speakers in that guide, as well as have a directory of other mental health professionals and resources that will help the Black community. Because it's all about starting the healing process and continuing the conversation so we can continue to heal, because we're always healing. And I just hope people realize from this that we're all on a healing journey. We're all Black in healing. So that's one thing I hope that people have taken away from this, is that you're not alone. You're never alone. Like I said, we're all on this journey together. And you don't have to suffer in silence, because help is out there. And we have a lot of resources that are available to help us on this healing journey. So thank you for joining us for Crazy is Not a Diagnosis, Understanding Mental Illness in the Black Community. And you can sign up if you have other people who want to sign up and receive the recording and resource guide. They can do so at helpingblackboysthrive.com/Black and Healing. And again, my name is Tressica Hamilton, and I'm the CEO of the Sid Center. And I want to thank you for joining us today. So take care, everyone, and thanks for joining us.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye-bye.